Okay, our next presenter is newly a radio star. He had his premiere this morning on the early edition of CBC. I'm sure you were all up at 5 a.m. listening to him. So Michael Kwag, many of you know, he is the project coordinator for the Sexual Health Resource Project at the Health Initiative for Men here in Vancouver. This is a new multilingual resource for gay, bisexual, and other men who have sex with men in the greater Vancouver area. Michael is a freelance project consultant with community-based and public health expertise in gay men's health and HIV prevention. Michael holds a Bachelor of Arts degree from UBC. So please join me in welcoming Mike Kwag.
Was I the only person that heard that, or I'm not sure? Okay, I'm not sure, just because as Travis mentioned, I did wake up very early this morning to talk a bit about some of the findings from this consultation that we did. So the title of my talk, we didn't get the talk, a sexual health community consultation with Chinese and Punjabi men in Greater Vancouver. That was a quote from one of our participants in the Chinese consultation, just talking about not having a lot of opportunities getting information or education, or what a lot of people in the Western world call the talk about sexual health. And given that the theme of this conference is health literacy, I thought it was a useful quote to pull. So I'm just going to go over a couple background items around the consultation, why we did it, and a bit about that multilingual sexual health resource that we were doing the consultation for. Talk a bit about the objectives for the consultation and the methods that we employed for it. I'll review some of the key findings from the consultation, but I want to talk a bit more about just kind of focus some of our time on some of the really key ones, at least in relation to the theme for the conference, and some of the next steps that we're considering in light of the findings from the consultation. So a lot of people have asked us, we started collecting this data back in February and March, and that was for the Chinese consultation. And a lot of people were asking, well, why Chinese? And when we got to Punjabi, why Punjabi? And I mean, I think, while there's definitely a need for doing other languages down the road, in general, I think there was a recognition that there isn't a whole lot of language-specific resources out there in the community. One of the things that came out of HIM's community consultation that we did back in 2011, which, among other things, outlined the need for population-specific sources of clear and trusted information. And, HIM did this consultation to increase their understanding of the diverse communities of gay, bisexual, and other men who have sex with men in Vancouver. One of the other things that I think forms an important part of the landscape of what we're talking about is the shifting profile of new infections by ethnicity, which is something that's been observed in surveillance data that's been collected over the past decade. So this was pulled from the 2012 BC CDC annual report. But back in 2003, Asian men made up just 3.2% of all new HIV infections among MSM. About a decade later, this proportion had increased to 18.1%, which is a pretty significant increase, and started to, I think, raise some alarm bells for folks in terms of what's going on with this particular population, and is there perhaps a need to develop more tailored or language-specific strategies. So, I'll actually start with what we were trying to do with the Sexual Health Resource Project. We came out at the outset wanting to strengthen our engagement with targeted communities in Vancouver, and to attempt to increase some knowledge and awareness of sexual health issues among these men, with the end goal of translating and adapting what we had hoped to be a comprehensive multilingual sexual health resource. In order to do that, we recognized that it was important for us to go back to our community and engage with guys of Chinese or Punjabi descent on their sexual health needs and experiences, and using this information to inform the development of this new resource. The 5 areas of the resource that we had initially set out to kind of cover were HIV and STI risk factors, risk reduction tools, acute HIV infection and viral load, HIV and STI testing, and mental health issues related to sexual health. So a lot of technical bits about safer sex and prevention. But upon doing the consultation, one of the things that we felt was important to add to this resource was a section specifically dealing with coming out and how to manage or deal with difficult family, social, or cultural environments. So, as I'm sure you could imagine, the eligibility for these consultation activities were that you had to be an English speaker, because I was conducting the interviews, and I speak neither Chinese nor Punjabi. So that is an important limitation to this data, is that while we were interested in learning more about the needs of men of these specific communities, we actually didn't have anyone to conduct these interviews in those languages. The participants who got involved in these consultations were often asked to kind of speak to sort of the greater kind of community that they were embedded in, to talk about maybe some of the experiences of some of their peers who might not have been able to participate because they couldn't speak English. So we recruited people through HIM networks, so email lists, newsletters, as well as social media. But the primary way that we ended up recruiting people was also through Grindr broadcast messages. We found that it was actually really effective in terms of reaching a set of guys that weren't typically involved in in a lot of things that HIM was doing, and these were guys that the message just popped up. If you're a Chinese guy who has sex with men, we'd love to hear from you. So people were invited to participate in either individual interviews or focus groups. People were given an honoraria for their participation. We also did a few key informant interviews with service providers that had experience working with these groups of men. Just another slide on methods, and I'll get to the results. The interview guide that we used focused on HIV and STI knowledge and related practices, their experiences accessing services, engaging with other gay men and other men with with men, as well as the gay community in general. Perceived barriers and gaps in services, and any suggestions that they might have had for community-based organizations and public health groups seeking to engage with guys like themselves. People were not required to provide names, and we actually didn't collect very much demographic information. So, the title of the talk, as I mentioned, is We Didn't Get the Talk, and that was really, I think, a key theme that came out of our consultations. So many guys talked about the limited opportunities that they had to learn about sexual health, let alone how to have good gay sexual health. A lot of the discussion revolved around, what some of the impacts were around, missing out on this important educational issue, whether that might be, getting basic safer sex information and knowledge, as well as, developing practical skills around, having good sex, including, how to communicate in a sexual context, how to be assertive in different sexual situations. And for a lot of these guys, this pointed to the need for renewed education efforts, specifically to ethno-cultural minorities where sex and sexuality were not openly discussed. Some participants who did grow up in Vancouver recalled receiving, random sex talk at school, but most people agreed that they received that they learned what they know about sex online, either via porn or using Google as a general information source for whatever questions that might come up. Certainly a very kind of a reactive approach to sexual health. And a few participants mentioned that they had friends who they would talk about sex with, but a number of people described limitations of relying on friends. Perhaps a source of outdated, misinformed information, or just not feeling particularly safe or comfortable talking openly about the sex that they were having. Yeah. So it's really small. I wasn't entirely thinking about that. Some of the other key findings just around perceived HIV, STI knowledge, risk, and practice. There were certainly mixed feelings about the level of HIV and STI knowledge, as well as the safer sex practice that was happening among their peers. Some people felt, HIV was a really salient concern for everyone, and that, people might not be super aware of all the details of transmission, but they know that HIV is a bad thing, and, no one wants to get it. But one thing that a lot of people talked about was, one, not being super aware of the other risks related to sex, but also just a general reliance on disclosure, expectations that, the partner that you're having sex with is going to disclose that they have HIV, or, even something like gonorrhea. That was identified as a concern across, their peer group. In terms of structural barriers, language was identified as a barrier for certain segments of these populations. Primarily newcomers. There was a perception that newcomers to Canada were considered to be just less knowledgeable about sex and sexual health. Some people argued that being more knowledgeable about sexual health could be perceived as something to be ashamed about. Like, why would you need to know about all these things unless you're a slut? And that once you start talking about HIV, probably means that you're gay. Now, a lot of people talked about the cultural stigma that exists around being gay, around HIV, and also just sex in general. For those participants that were out or somewhat out to their family or their cultural community, a lot of people talked about different pressures that were out there to conform and play down their sexuality. And certainly all of these things affect these guys' connection with gay community. People talked about the challenges in meeting other gay men and other men who have sex with men. We're primarily looking for, other guys online. General unawareness of, available services and resources that were available. A lot of people didn't really know about him until we did these consultations, at least with this particular group of guys that we were talking to. A lot of people gave really positive feedback about the organization's services once they learned more about what it is that we offer. But a lot of people also felt like they just felt disconnected from the whole idea of what we did. And we're quite pleasantly surprised that there are groups like him that are providing these services. One related point on that is that people did talk about the lack of cultural representation in mainstream gay community, and how that could make it difficult for them to, one, relate to what was happening in the gay community, but also to see relevance in the kinds of services and programs that are available for gay men. So I think what we learned is that addressing structural barriers to sexual health definitely needs to be a priority if we want to be enhancing our engagement with these communities. We need to be proactive around dealing with stigma. Not everyone is at a place in their life where being gay is totally fine, and being sensitive and responsive to those realities, I think, is important. To some extent, there are some important language barriers that need to be addressed, and providing this resources is just one small part of that. Certainly increasing our capacity to engage with men who are experiencing language barriers to service access definitely is something that needs to be considered. Certainly around the isolation and disconnection from gay community, I think all of this represents an important opportunity for groups like him and public health organizations in terms of finding innovative ways of engaging with these guys. A lot of these guys talked about being interested in finding new social spaces to meet others, or just any way of finding other gay men outside of a bar, or perhaps outside of a sexual context even. So just quickly, our next steps. I think the plan is to expand our consultation with other ethno-cultural communities down the road. We just wanted to get the Chinese and Punjabi one off the ground. There's definitely a need for additional research. Now, this was a pretty small, informal consultation, but I think there's a need to delve a bit deeper into what's going on with these men, particularly around their experiences being a gay person of color in Vancouver. Presents some pretty unique challenges. And we will be launching our new multilingual resource hopefully by the end of November. So stay tuned for that.